Thank you for joining us for another video on dental malpractice. In this video, we're going to be talking about a painful topic, root canals. Botched root canals are a major source of complaints within the state boards of dentistry, and they're also a major cause of dental malpractice lawsuits. So let's dig into this topic and talk about root canal procedures and dental malpractice.
Let's start out by talking about the root canal process. When a dentist is performing a root canal, typically the first step is to drill away the top surface of the tooth to expose the canals of the roots. When you're looking down at the surface of the tooth after drilling away the surface, you can see little holes or several little holes depending on how many roots the tooth has. After that, the dentist will go in and remove the pulp with a tiny little instrument called a root canal file, or the dentist may also use a rotary instrument. Then the dentist will cleanse the inside of the root canals, seal the inside of the canals, and then stuff a rubbery material into the canals, which is usually a material called gutta percha. After that, the dentist will seal over the exposed root canals and finish up with a crown. Now, that's a very simplified and abbreviated discussion of the root canal process, but it's enough to give you an idea of what goes on during a root canal procedure. It's also enough to make your skin crawl just a little bit, especially if you've ever had a root canal done. Not usually a very fun experience.
Now, let's talk a little about dental malpractice and root canals. So what is considered dental malpractice in the context of root canal procedures? Well, let's start off with a very broad discussion before we get into specifics. Dentists or root canal specialists called endodontists may be liable for dental malpractice if they breach the standard of care in performing a root canal procedure. When you have a viable dental malpractice claim, that basically means that the dentist or other clinician breached the standard of care, and you are entitled to compensation for the damage that breach caused you. So, for example, you may be entitled to money for your medical bills to repair the damage done to you. You may also be entitled to money for your pain and suffering, and for your missed work and lost wages.
Now that we've talked about root canal dental malpractice more broadly, let's dig into some of the more common types of dental malpractice cases involving root canals. So first, we'll talk about unnecessary root canals. If a dentist performs a root canal on a tooth that does not need it, the dentist may have breached the standard of care. Part of a dentist's job is to properly justify a course of treatment. Thus, if there's no justification for the treatment, that's a problem. You might ask, what's the problem if a dentist does a root canal on the wrong tooth? Well, first of all, the patient had to go through unnecessary pain, and the patient had to pay money for that fun experience. However, most importantly, that root canal will likely shorten the life of the healthy tooth. Therefore, the patient may lose that tooth earlier than if the tooth had been left alone altogether. And if it's a permanent tooth, it's not going to grow back anytime soon.
Now, let's talk about root canals on the wrong tooth. Just like an unnecessary root canal, a root canal on the wrong tooth is a clear mistake, and it causes the same issues we just talked about. A root canal on the wrong tooth is due to the dentist rushing through the procedure, or it's just absolute incompetence. In other words, there is no excuse for doing a root canal on the wrong tooth. That's just sloppy, and it's clearly negligent. It's like a doctor amputating the wrong finger. It's difficult to say he or she did nothing wrong.
Now, let's talk about incidents where the dentist drills too deep into the canal. As we talked about earlier, part of the root canal procedure is to drill into the canal with an instrument to remove the pulp from the canal of the tooth. As you can imagine, the tip of the root comes down to a point. That's usually called the apex or the root apex. If you drill through the apex and through the root cap, you end up outside of the tooth and in the surrounding tissues. As you can imagine, this is not good, and it's not supposed to happen. When the dentist drills through the apex of the root on a top tooth, the dentist may puncture the sinus, which could cause nosebleeds, constant sinus infections, sneezing, and all kinds of other problems. If the dentist drills too deep into the root on a bottom tooth, especially a molar, the dentist may puncture the inferior alveolar nerve canal and cause nerve damage. In this situation, the patient might experience numbness on the chin, the jaw, or the face, and that may last forever. For that reason, these are some of the more intense dental malpractice cases involving root canals.
Let's talk about a plain old botched root canal. This is where the dentist simply failed to properly perform the root canal procedure. So, when a dentist doesn't properly perform a root canal, for example, by not removing all the pulp from a canal, then the pulp stays in there until it rots the tooth from the inside. This will cause the patient intense pain, and it's likely to lead to an infection and maybe even an abscess. Although all of this is inconvenient and super painful, the real tragedy here is the loss of the natural tooth, which can never be replaced. Now, as a result, the patient will need some sort of prosthetic substitute, which is never going to be as good as the real tooth, and it's going to cost a lot of money and take a lot of time.
Another way the dentist might commit dental malpractice is by overfilling the root canal. Sometimes a dentist will pack too much material down into the canal of the tooth, and as a result, the material can be forced out of the apex of the root and into the surrounding tissues. On a lower tooth, the material may come out of the end of the apex of the root and intrude into the inferior alveolar nerve canal and cause permanent nerve damage. On an upper tooth, the overfill may cause damage to the sinuses. Either way, when material is forced out of the apex of the root, it's going to cause the patient pain and serious complications.
Now, let's talk about a broken root canal file. As we talked about earlier, the root canal process often involves using a tiny little root canal file to go into the root canals and remove the tissue. These root canal files are extremely thin. If the dentist uses one of these files one too many times, it will likely break off in the patient's tooth. Also, if the dentist happens to snag the canal at the wrong angle, it may even break off a fresh file. Because of the nature of the procedure, breaking the file itself may not be dental malpractice. The dental malpractice is usually what happens next, or more appropriately, what does not happen next. When a dentist breaks off a root canal file, the dentist is supposed to inform the patient right away and explain to the patient what happened and what the patient's options are for subsequent treatment. Also, the dentist is supposed to either try to remove the broken piece of file or refer the patient to an expert right away to get that file removed. Some dentists choose to keep quiet about the file, and they don't tell the patient, and they don't refer the patient to a specialist right away. This is potentially dental malpractice.
The last issue we're going to talk about today is a perforated tooth during the root canal. Sometimes the dentist will accidentally or mistakenly drill out of the side of the patient's tooth during a root canal procedure. To make matters worse, the dentist may not even realize that he or she drilled out of the side of the tooth. In other words, the dentist may drill a hole through the tooth and into the patient's bone, thinking that the dentist is drilling into a root canal. Then the dentist will use cleanser on the freshly cut bone and then push sealant into that wound. Finally, the dentist will stuff the gutta percha material into the freshly cut bone and then send the patient home. This not only condemns the patient's healthy tooth, but it also causes excruciating pain, and it could develop into a very serious infection.
Thank you so much for joining us for another painful episode on dental malpractice. If you like this content, please smash like and subscribe to our channel, and we'll see you at the next video.